which of the following is not done in active management of third stage of labor? Okay, so when you say active management of third stage of labor, please remember it is done before the woman delivers and the placenta is out. See, when a woman delivers and the placenta is out, you give oxytocin, methyl argometrin, that anybody can give and the bleeding will reduce. Good. But what if I do something even before the baby comes out? So that is what is known as the active management of third stage of labor. So we start a management in the second stage itself. Moment the head of the baby comes out and the anti-shoulder comes out. Moment the anti-shoulder of the baby comes out, we give oxytocin to the mother, intramuscular. We can give it IV also, 10 units intramuscular we give, and by the time the whole baby is taken out of the mother, and then we do the control cord traction to take out the placenta. Of course, before you do the control cord traction, we will hold the baby down. We'll hold the baby down from the mother's body. Look, the baby has come out, and then once the baby comes out, we keep the baby a little lower than the body of the mother so that there is a 1 gram gain of hemoglobin for the baby. So delayed cord clamping also we do. So at the delivery of the anti-shoulder, give oxytocin to the mother, delayed cord clamping, and after that, once the baby is given to the nursery, then we do the control cord traction. And when the placenta separates, by the time the oxytocin peak action has come, and then we put a hand in the vagina, one hand on the abdomen, and give a gentle uterine massage. Please, massage is part of active management of third stage of labor. Please don't say massage is not done. I have said this repeatedly in so many forums. If you say massage is not done, then you're already contradicting 3 major institutes of the country, AIIMS, JIPMER and PGI, because the question in INI-CET came that where do you do uterine massage and where you do early cord clamping and where you do oxytocin. Put the things in right order. That question has come in these exams. So please go ahead and do uterine massage. We are not going to discuss the controversies much here about this anymore. So which of the following is not done in active management of third stage of labor? So we do early cord clamping. No, we do delayed cord clamping. Okay. Then uterine massage, yes, it is done. Control cord traction, it is done. Uterotonic after placenta delivery, this again is wrong. Okay, so this question when it came in the exams, I had taken out 2 mistakes. So I think maybe it's a bad recall. Please remember, we do delayed cord clamping and we do uterotonic at the delivery. We do it at the delivery of the anterior shoulder. We do at the delivery of the anterior shoulder. All right, let's move on. So PPH, active management of third stage of labor, remember administration of uterotonics and oxytocin and control cord traction when skilled birth attendants are available, and then late cord clamping, that is at least 1 to 3 minutes, at least 60 minutes they should be there, and then massage.